Suzanne, welcome to the studio.
Hello, thank you for having me.
And what's your role in the organisation?
So I am the sepsis lead nurse here in the Trust.
Brilliant. It's a pleasure to have you.
Thank you.
So we hear about sepsis quite a lot.
Yeah.
Can you explain what sepsis is?
So sepsis is your body not reacting to an infection in the way that we'd like it to do, and it becomes disorganised, and effectively your body starts attacking itself, its cells, its organs, and it is life-threatening, which is why it's so important that we get prompt treatment and get into hospital and get seen really, really quickly. Most people will think, sepsis, infection. And yes, you need an infection to get sepsis. But then it becomes not just an infection. We're not talking about a bad infection. We're talking about this assault, this attack on your body. And it's not organised. And yeah, it's so much more than an infection. So antibiotics alone are not going to fix sepsis.
Wow, it's quite scary, really.
It is, and it can be very frightening if you are the one that's given that diagnosis or left in the community and wondering what's happening.
Yeah. So what are the ways to prevent sepsis or avoid an infection or other illnesses leading to it?
So, yeah, you're never going to get sepsis without an infection. Mm-hmm. So in hospital, myself and my healthcare staff and our teams, we should be making sure we are following all of those infection prevention processes that we should do. Good hand hygiene, making sure equipment is clean and used correctly, single-use products only used once. Obviously, if you are listening at home in the community, you're not going to be giving yourself injections. Well, you might be, but we're not talking about hospital care. And in fact, sepsis, only 20% of it will start in a hospital.
Right.
80% of people, cases of sepsis will start out in the community. So it is, if there are steps you can do at home to reduce the risk of infection, that's great. And that's as simple as flu vaccinations are coming out. So get your flu vaccine if you're entitled to it. Don't get the chest infection, which won't get to pneumonia. And then you are not likely to get sepsis from it because you haven't got that infection. So things like that are really, really important. If you're gardening, wear gardening gloves because you don't want to be getting a horrible, yucky infection in your finger that then potentially could lead to sepsis. So looking after your bodies and not taking those risks, which we can kind of shrug off. But actually, if you start thinking, well, what if it does develop sepsis, which is this really long, drawn out process to recover from, it can lead you with really nasty long side effects. Long term post sepsis syndrome is something we're learning more about. So yeah, just look after yourself, have your flu jabs, make sure you're using clean equipment, don't go gardening with a horrible cut on your hand, be sensible, really.
Yeah, a lot of common sense kind of.
Absolutely, yeah. That's not really it.
What are the signs that we should look out for and be aware of?
So the UK Sepsis Trust are great, and I've got some really lovely handouts that you can get, and a lot of it is actually also on our hospital page. But for adult, you need to think sepsis. So you're thinking slurred or slurred speech or any confusion, and actually confusion is a really big one to look out for. So if you're visiting your neighbour and you walk away and you think, my gosh, they're complaining about this nasty cough, but they just seem a bit odd today. They were talking about their cat and they haven't had a cat for a couple of years. Start thinking, hang on, this person's confused. This just isn't normal. And that's really important for us in healthcare settings as well. We need to be looking at our patients and thinking, is there any deterioration from their normal sort of alertness? Are they showing signs of confusion? So that's the first S. Our next E, it is extreme shivering or muscle pain. So they start talking about, I've got these aches and pains, and that is to do with the process of sepsis and the your blood changing. You have this thing called lactate which rises in our body, which we're not expecting you to all become scientists and know all about, but those aches and pains actually are a real big sign, or those massive shiverings and feeling really uncomfortable in that way. P is passing no urine in a day. So we're talking about you haven't been to the toilet all day, or your granny who you're looking after is in bed with a bit of flu, and actually you suddenly realise they've not asked for your assistance to get to the toilet. These should be those alarm bells that are ringing, that you're thinking, hang on, this just isn't normal, something's happening here. So that's your P. Your next S is severe breathlessness. Not being able to talk in full sentences, gasping for breath, that breathing becoming quicker. In hospital, we're looking at your respiratory rate, how quickly you're breathing all the time. In the community, it's just looking thinking, gosh, you're struggling to breathe. And that's a really big sign that actually sepsis could be the cause of this illness. The I is, I feel like I'm going to die. And again, this is because you're struggling to breathe. It's taking so much energy to be able to breathe. Your body's attacking itself and nothing's working how we want it to do. You've got this raised lactate. Everything is just beginning to assault your body. And if you've got someone who's going, oh God, I'm done. I actually spoke to somebody whose mother was unwell, and she started phoning her family and saying, I'm not going to be here in the morning.
Oh, bless her.
But he knew that something wasn't right, got her into hospital, and they recovered. So those sorts of conversations are just take them seriously. This is your cue to act now. And then your final one, the final S, is for mottled or discoloured skin. Now, they're not going to be prevalent for everybody, so you don't have to tick every one of those boxes. If you start to see any of those signs, then you need to be getting help. So call 111, phone 999, get to your GP, or bring yourself into A&E if you feel that that's your most effective way to get your help. It's slightly different in children because they show things differently. So in children, is their breathing fast, which is very similar. Unfortunately, there's no nice snappy words for this. So have they had a fit or convulsion? If they're looking again like their skin is mottled, blush, or are they looking pale? Have they got a rash that isn't disappearing if you press it with a glass? Are they really tired and just not themselves, floppy, lethargic? You as a parent or caregiver, you know that child and you've got to follow your gut. Melissa Mead, who we are delighted to have a positive relationship with here in the hospital, who works for the UK Sepsis Trust, and people will have heard of William's story. She knew something was wrong with her child. And it's really, really hard when you're fighting, but you just have to really stomp your feet and say, look, my child is not right, and say, is this sepsis? And then finally, are they feeling cold to touch? Because actually it's a lower temperature, which is far more serious and far more alarming and concerning than a higher temperature for children.
Okay. What was that acronym you were using for adults again? So
sepsis, slurred speech or confusion, extreme shivering or muscle pain, passing of no urine, so in a day, severe breathlessness, I, it feels like I'm going to die, and S for skin that's mottled or discoloured.
That's really useful to know. Thank you.
Worries.
At RCHT, we obviously want to give outstanding care to all our patients. What's being done to improve the way that we identify and treat sepsis?
So currently, since I came into post 2 years ago, we've had it agreed that sepsis training will be mandatory. So our nurses, our healthcare, lots of our staff, we do regular training and we have to get things signed off every year. We've had it approved that sepsis is actually also going to be a subject of that, which is brilliant because it means that we can make sure that our nurses are getting this, and it will be updated every year. So I'm currently working my way through the hospital. I do it in lots of different ways. I will get a call from a ward to say, look, we've got some members of staff, could you come? And I'll go and visit them, and I'll stand in their kitchen or in their treatment room, and we'll have a chat and we'll go through some information. It's also part of some of the hospital bigger programs that they're doing. They're doing some training which is open to anyone, allied health professionals, physios, OTs, nurses. So it's on that. And I deliver on that monthly, which is brilliant. And lots of wards are signing up their staff on that because it covers not just sepsis, it covers it's got the end of life care nurses that come, and the infection control nurses. So that's a really good way to get loads of these extra subjects ticked off in one day. And it's a really, really engaging day with such a variety. So I'd really encourage anyone to do that. I'm also talking with our senior clinicians as part of their yearly update. So we're just really trying to get it out. I've done silly things like Sepsis Susie is now my alter ego on Facebook.
Brilliant.
And I get so much engagement from people on the community as well saying, oh, can you come and do teaching here? And unfortunately, I haven't got the authority to go out to other places, but I can point them to the education and the material that's out there through the likes of the Sepsis Trust. So it's been really engaging to be able to do that. A lot of what I'm doing is funded by the RCHT charities. So if they do crazy ideas, I try and join in on them. So last year I did their walking on glass and coals and Lego, which was so much fun. But also I think I raised sort of like £500, which I've been able to use. And then this year for World Sepsis Day, which was the 13th of September, I was able to provide some notebooks to our people that came to a course. We had a whole day where we had a special interest day, which was supported by our infection control team. We had our brilliant ED team came, and one of their consultants, Mark Jadov, did a really interesting presentation on what they're doing and how they're improving recognition in ED. So I might be the lead nurse, it might be my role, but I couldn't do it without the sign up and the support and the engagement of all of these fabulous people across the trust.
Amazing. It sounds like there's so much going on across the organisation just to raise awareness of sepsis.
Yeah.
Brilliant. Electronic systems are playing an increasing role in supporting patient safety. Are we using any of those to help us with sepsis?
Absolutely. So as a trust, we use a system called Nerve Centre. So when you might have noticed in hospital, you're having your blood pressure, your heart rate put into an iPod. Those nurses aren't just playing on their phones. They are absolutely entering this important information and able to record your process and your journey and any deterioration or changes. Within that system, I think off the top of my head, it was before I was in post, but I think it was 2018, 2019, we added the ability for it to actually screen for sepsis in it. So what that is doing is, as the nurse is adding your blood pressure, your heart rate, it is looking for the scores that might be a sign for sepsis. And actually News 2, which is the when we combine all of the blood pressure, your heart rate, and whether you're confused or alert, when we combine all that together, we get what we call a News 2 score, which is National Early Warning Score, and then 2 for version 2, because we changed it a bit. So that is actually the best system we've got for identifying whether a patient might have sepsis, and we're looking for people that have got a score of over 5 or 3 in one area, so one area is scoring quite high. Yeah. And that nationally is recognised as the best idea we've got, the best tool we've got for saying, I think that patient might have sepsis. So that's being brought in. And it's quite exciting that I'm here with you this week, because next week we're actually starting a pilot on ESU and Wellington, and their staff have been brilliant, and that's come from like their matrons, their ward managers, and the staff on the wards, the nurses and healthcares and the assistant practitioners. They've all been fab and really excited and engaged with this, because what they're going to be doing is, instead of recording a patient that is being treated for sepsis in a sticker that goes in the notes, they're going to be doing it in Nerve Centre as well. So that's an assessment that they can, if they think my patient might have sepsis, they're going to click a very small button that will add that assessment into it. And that is going to give them the ability to record every step of what they're delivering. But the other thing is, it's got prompts. So it's telling them, right, you need to get this doctor here now. And it talks them through it. We need to give them fluids. What fluids? How much are we giving? It's all in there. So it's really, really easy for that nurse or the person delivering that episode of care to have clear guidelines of what they're doing. And then for me, what's really useful is I can then review that, and then we can say to the trust, actually, we need another doctor working here because we're not able to do that. Or this ward did this brilliantly, and they need the praise and the recognition of doing that. Or on this occasion we didn't get the fluids in because we couldn't get a cannula in this patient. Well, what other options have we got? But right now we don't have the information to know what to fix, and we're going to have it because we're going to be collecting this. So if this works over the next couple of weeks, this will hopefully be going across the whole trust.
That's so exciting.
It really is.
Brilliant. I love it. And that's must make their life so much easier as well, being in such a busy environment, taking, just assisting the nurses with having those extra steps that they can look at, and those early warnings and stuff like that can be just make life so much easier for them. Yeah,
and when they are really busy, and if you've got a patient that you're thinking's got sepsis, that patient's unwell. Yeah, it is a medical emergency. Yeah, and we know that in emergencies, we all, I mean, my gosh, me coming in here today, I said to you, I'm nervous. We all know that we're under pressure. You're like, oh my gosh, am I going to be saying the right words? I've got a couple of bits of paper here with some words to make sure I'm saying it correctly, because we all lose it under pressure. So if we can do something that considers that nurse might be feeling it, to give that checklist, that walkthrough of this is what I need to do. But also as part of this implementation, it's not just being as simple as this form's coming to you, do it. We're actually explaining to them why they're doing each of those steps. So again, we are giving them those initial like that training of why we're doing it, and just revisiting it for them, because for some of them it might have been a while, and we all learn every time. We do some of our training the same every year, don't we? But you always find something new each time. You go, oh, yeah, actually, I remember that bit this time, which hadn't clicked previously. So it's been a really lovely opportunity. And as I said to you, couldn't have done it without the ward's support and their enthusiasm. It's been, I am really, really excited, because they are like, we like this. So hopefully it'll be coming everywhere.
That's great. So, as you said earlier, the 13th of September was World Sepsis Day.
Yeah.
And September has been Sepsis Awareness Month.
Yes.
What's the most important takeaway message for everyone listening, and where can they find out more information?
Okay, so as we mentioned, thinking sepsis and those points for your children. So definitely take that away with you. Anyone that wants to know more, we have some links on our hospital website. If you Google sepsis in the top, it will come up with some of those links. Or you can go straight to the UK Sepsis Trust website, and there's loads and loads of information on there. They also have some training which is open to everybody, and it's their campaign called Sepsis Savvy. And so anyone can do that. Like, you can get your mum to do it, and you can do it on your phone. It's really easy, and it's just giving you a little bit of information to just have an idea of what to look out for in the community. As I said earlier on, 80% of sepsis cases will start in the community. So yes, I can push here in the hospital to make sure that we are doing our best. But what we also need to be doing is making sure that our gran knows what to look out for herself, or mums on the school run, anybody, that we understand that sepsis is a potential killer, that acting quick really does improve our survival rates. And it kills 48,000 people every year in the UK.
Wow.
And did a little bit of Googling, and that actually is the equivalent of Hale, Camborne and Redruth, I believe. So if we were thinking of those three areas wiped out in a year, everyone would be going on to Sepsis Savvy.
Yeah.
And getting that little bit of knowledge.
Thank you for that.
Oh,
That's incredible.
Yeah.
Thank you very much for your time today, Suzanne.
Pleasure.
It's been great to have you.